Good evening, everyone, and welcome to the Northern Queensland Primary Health Network Joint Regional Needs Assessment Town Hall. I'd like to welcome you all this evening, taking time out of the end of your day to join us for a key update around our project. There'll be people coming into the call as we start to progress through the slides. So please just take note of the Menti code at the top of the screen. We will be doing some interactive feedback with the group this evening. So if you've got the ability to grab your mobile phone and join at menti.com with the number 82336960 as the joining code, that will enable you to follow through on the slides and also interact with the questions at the end of the presentation. Joining me on the call this evening is Cara McCormack, who will be talking about the Joint Regional Wellbeing Plan a little bit further into the presentation, and also my colleague Samantha Lobo, who is assisting with the analysis of the data. I would like to take this moment to acknowledge the traditional custodians of the lands and seas on which we live, work, and pay our respects to our elders past and present. I'd like to reach out to all of our Indigenous colleagues that are on the line this evening. This evening, what we're talking through is a little bit about the project. Some of you may have already joined one of our stakeholder consultation sessions. So we'd like to provide just a brief overview of the framework behind the consultation and behind the project, the process that we've undertaken, and how we will be identifying priorities around health needs, what we've learned from the consultation with you as community and key stakeholders, and then you'll have the ability to provide some interactive feedback towards the end of the presentation. So what would really help us understand who's in the virtual room this evening is to know what your role is in the community. So if you could choose one of those actions, if you go to your menti.com app and just choose the best option that suits your representation tonight, that would be great. Great. So it looks like we've got a majority of health service providers on the call this evening, and a nice proportion of consumers as well joining us. Okay, so we'll launch right into an overview of what the Joint Regional Needs Assessment is. So for the first time this year, PHNs are working with the hospital and health services across Queensland. We met as a working group late last year, and in partnership with Quake and Health Consumers Queensland. In Queensland, we have developed a framework that will be used throughout the state to deliver this work. So the Joint Regional Needs Assessment is a large piece of consultation and analysis around data that's done in every 3 years, and every year we refresh that just to ensure that we're on top of any emerging health needs that might pop up in that 3-year triennial cycle. Once we complete our Joint Regional Needs Assessment, it evolves over time over those next couple of years, and we use this information to help us develop commissioning approaches and to identify gaps in services and health needs across our region. It provides us with a demographic profile so that we're able to understand what's happening out in our communities at a very low level, and also helps us to identify shared priority areas that we can work on with our hospital and health service partners in terms of future commissioning or advocacy or collaboration around service delivery. The infographic just provides you with a very graphical overview of the process. So initially we collect a lot of data from places like the Australian Bureau of Statistics, the Australian Institute of Health and Welfare, and then we also look at other data sets that may not be as publicly available, and we start to form a picture of what's happening in communities across our region. We also then move to a triangulation phase, which is just ensuring that we've got adequate evidence of the need across our community. So we go out and talk with stakeholders, we look at other sources for data, sources for confirmation that this is actually a confirmed health or service need, and then we start to move through the process of prioritisation. So listing all of those health needs that we discover, health and service needs, and then putting a formula across it to rank that for our region. Each of the hospital and health services are also doing their own prioritisation and triangulation process, and we will come together to ensure that we are approaching the shared priorities in a collaborative manner. This is another infographic of what the work is typically. Previously, it has been called a health needs assessment, so some of you may have been familiar with previous iterations of this document, and the hospital and health services have been previously called LANAs, or local area needs assessment. So this year, with the framework, we're combining those and delivering a joint regions needs assessment, which is really exciting. These are the links to the, this is what the toolkit looks like. It comes with a frame kit, and there is a toolkit, and that's publicly available if anybody's interested in following up on that link to learn more. The project runs for approximately 12 months. We started this work late last year, started looking at the publicly available data from the ABS from 2021 and reviewing our commissioning data from the last 3 years. And then we've moved into a quantitative and qualitative period over the last couple of months where we've been heavily consulting across our region. Moving forward, August and September, we're moving into validation, triangulation of the data. So that's basically, as I was saying, just confirming that we've got real evidence of health and service needs across our region. And then later in September, we will be prioritising that, standing up our prioritisation committee, and then working through that very mathematical process of being able to score each health need across our region to a set criteria, ready for submission from the Northern Queensland Primary Health Network side to the department on the 15th of November. And the hospitals will also submit to their state bodies around the same time. So across this whole continuum, we are continually engaging with our stakeholders, and that will continue as we cycle through the various iterations and refreshes. What we're doing together with our hospital and health services, as I mentioned, we are working in collaboration with the 4 hospital and health service regions that sit within our overarching region. We are sharing project governance, the promotion of the framework and the key deliverable. We're sharing community consultation and engagement where it's practical. We're also sharing public and protected data sets where we have the appropriate data governance in place. And the qualitative data through engagement and consultation is also being shared across our partners. And we're also developing tools so that we can access this data interactively and create an environment that's flexible for all the partners to access that data as they need. So we are together also working around understanding the various health needs identification and prioritisation methodologies. Given that our partners and PHN work in very different contexts, we're going to have a slightly different prioritisation methodology versus the hospital. But we are making sure that those methodologies do have some interlocking pieces so that we're actually sharing the baseline data across the region, which is a first for our particular region, which is amazing. So at the end of this, we will likely produce a shared document that can be used across the region and promoted across each of the hospital and health services. We're still working through what the format of that will look like, as it's their first year. So I'm just going to pass you over to Cara, who's going to talk to some other fantastic work that's underway, the Joint Regional Wellbeing Plan.
Thank you, Janine. The Joint Regional Wellbeing Plan is a plan specifically focused for the whole of Northern Queensland on mental health, alcohol, other drug and suicide prevention needs for our community. We have an existing plan that was established and signed off in 2020 and is a joint plan, just the one plan signed off by both the Primary Health Network and all 4 hospital and health services in our region. We are now in the process of a review of that plan and are working towards a finalisation of a comprehensive plan for June of next year. In a similar way to the governance and partnership work for the Joint Regional Needs Assessments, we have a steering committee that's co-chaired by the Primary Health Network and a Hospital and Health Service representative, and have broad representation from all hospital and health services on the committee. We're approaching the consultation and development of the plan in 4 stages. We have undertaken a data review of available data from Hospital Health Services, the Primary Health Network, and Queensland Mental Health, Alcohol, Other Drugs branch. And we now have used that data to really inform the scope for our plan. We're currently in a consultation stage and are working closely with the Joint Regional Needs Assessment work to share intel. We know that from our LANAs and HNAs that mental health is often a really strong need that does present. So this really gives us an opportunity to spend time and more deeply dive into this need specifically to mental health, alcohol and other drugs, and suicide prevention. We'll be undertaking this consultation over the next few months, and then we'll work to a prioritisation of those actions and development of the plan, and some key actions that will really inform the focus for mental health, alcohol and other drugs, and suicide prevention as a system over the next few years. As a part of this plan, we have also established a lived experience advisory group, which is made up of representatives from across the hospital and health service regions, and across specific lived experience of mental health, alcohol, other drugs and suicide prevention are all representatives. We will be within the new plan having region-specific chapters, really to just ensure that there's quite strong local relevance in the new plan. Thanks, Janine.
Thanks, Cara. So that's really some important work that's underway at the same time, which is it's kind of aligned for us because we can share feedback from those consultations. So I just wanted to run through some of the key national and regional insights initially, and then we'll move on to some of the survey, what we've learned from the survey. So this map or infographic displays where we are situated. So we are a very large PHN, the second largest in Queensland, in fact, over 500 square kilometres. And you can see the population breakdown there. We have 4 hospital and health service regions within our overarching region. 3.8% of our population live in remote areas and 3.6% live in very remote areas. Some key stats there around the median age and the projected population by 2046 being just over 900,000. We have approximately 10.8% Aboriginal Torres Strait Islander population, and a large proportion of our population, 16.1%, is over the age of 65. So this is just a breakdown again of that, the demographic, female versus male, the percentage to there, and how many over the age of 65 are requiring assistance. So we've got a large population that's dependent on other carers potentially, and we've got a large population there in the over 65s that are identifying as Aboriginal and Torres Strait Islander. 10 LGAs in our region have more than 15% of the population 65 years and over, and some of those LGAs are listed there that have the largest percentages. So Hinchinbrook, Tablelands and the Burdekin. In terms of understanding the ethnic tapestry that is rich in our region, so we have 15.1% of our population born overseas, and 8.5% of those are born in a non-English speaking country. 10.8% of our population spoke a language other than English at home. And those LGAs listed there are the largest percentage of persons from a non-English speaking country. Cairns has the largest percentage of persons born overseas, and probably likely attracted to the nice tourist spot that Cairns is. And then we've got a large proportion up in our Torres and Cape region of persons who spoke a language other than English at home. Schooling in our region, the highest level of completion, approximately 56% have completed year 11 and year 12 or an equivalent level of schooling, and that's in comparison to 63.6% of Queensland being the average. In Torres LGA, the highest percentage with year 11 and year 12 was 65.1%, and Pomporoa with LGA, we have the highest percentage of individuals with year 8 or below as their highest schooling of 14.3%. In terms of the Australian Defence Force, we have a large population living in our region as well. 5.1% either currently or have previously served in the Australian Defence Force. And those little dots on the map show you where those people are currently living as of the 2021 census. And so Cairns and Hinterland is where that highest proportion has relocated to. In terms of disability, persons with profound or severe disability are 5.4% deaths recorded in our region in 2022. And the largest proportion of the disabilities are listed there in those 3 LGAs. 8.3% for Hinchinbrook, 6.8% for Cassowary Coast, and 6.6% for Burdekin. In terms of the socio-economic disadvantage, all of our region is virtually in a quintile 1 to 4. We have some areas on the edge of the coast which aren't, but you can see that 26.8% of our region are in the most disadvantaged quintile, and those are listed there on the screen. In terms of social and economic factors impacting health, unemployment as of September 2023, we had high unemployment in the LGAs of Palm Island, and Weipa had the lowest LGA, probably what we could explain as a large mining or fly-in, fly-out population in that region as well. Homelessness, people in our region experiencing homelessness are approximately 5,000 at the time that we've pulled the data, but what we're hearing on the ground is there's an increase in homelessness across our region as well. Yarrabah had the highest rate of people experiencing homelessness. Mental health. We have had a slight decrease in intentional self-harm hospitalisation, which has declined overall, but we've noticed an increase for females with a percentage of 32.1% for females and 11.1% for males. We've had 13.1% noted deaths due to suicide in our region as at 2022, and we note that it's higher. Deaths due to suicide are higher in males at 83%. Sorry. Life expectancy. This is just a snapshot of the life expectancy male versus females, and the top 5 leading causes of death from our region between 2018 to 2022, being coronary heart disease, dementia, including Alzheimer's, lung cancer, stroke, and chronic obstructive pulmonary disease. In terms of chronic health conditions, 26.3% of our population are living with 1 or more long-term health conditions. The LGAs with the highest percentage of 1 or more long health conditions are Hinchinbrook at 33%, followed by the Burdekin at 30.1%. Across our region, the most common long-term health conditions were mental health, followed by arthritis, asthma, diabetes, heart disease, and cancer. Immunisation rates. So we've noticed that the childhood immunisation rate for 1-year-olds in our region has seen a decline from 93.9% to 92.9%. So that's in the blue. The 2-year-olds, which is the lighter blue, has also observed a decline over time. And we've got an increase in the 5-year-old immunisation rates over time. In terms of health risks and looking at smoking, the prevalence rate of daily smokers aged over 18 years, as at 2023, are shown there on the screen. So Queensland will be shown on the right-hand side of the screen, and NQPHN overall as a region is in the green, and then the various hospital and health service regions are shown here. So orange is Mackay, red is Townsville, Cairns and Hinterland is shown in the lighter blue, and then Torres and Cape in the darker blue as we move through these next few slides. In terms of obesity in weight, the prevalence of obese and overweight adults 18 plus as of 2023 are shown there as well. So we can see a decline in those living in the Cairns and Hinterland region, but an increase in Townsville and Hospital Health Service region, the highest being in the Mackay region, and overall we're quite high in comparison to Queensland in terms of obesity and weight. In terms of physical activity, the prevalence rate of sufficient physical activity 18 plus at 2023. So we've got a high prevalence in the Townsville region and lower prevalence across our other regions, Mackay and Torres and Cape and Cairns and Hinterland being lower than the North Queensland region all up, and also much lower than the state average. In terms of drinking, the prevalence of the rate of risky level of alcohol consumption, 18 plus years at 2023. We can see there's higher rates in the Torres and Cape region. Cairns also, Townsville slightly lower than the North Queensland PHN average, but we're still well and truly higher than the state in terms of prevalence of risky drinking. In terms of cancer screening, we're really leading the way in terms of the highest participation rate. If we're looking at PHNs, we've got 58.9% participation rate. We've got the highest of breast screening participation rate among SA3, which is the statistical area in Charters Towers, Ayr and Ingham at 67.2%, so that's great news, noting that that data is probably a few years old as well. The participation rate for bowel cancer screening in our region is slightly lower than the Queensland rate of 37.5%, and the estimated participation rate for cervical screening in Northern Queensland is on par with our national rate at 62.4%. In terms of health workforce, this is a very high-level snapshot. Approximately 1,700 general practitioners, 35.4% of our general practices are located in a rural and remote area. We refer to those as MMMs, or modified Monash model for those health service providers on the call, 3 to 7, which means that they're quite remote. We have 18 Aboriginal community-controlled health organisations that we work with as well. Quite a large number of nurses, and a lot of nurses working in primary care, with 369 of those being enrolled nurses. I'll just move on and just talk through the notifiable conditions. So with syphilis, we've noticed that there has been an ongoing outbreak of infectious syphilis across our First Nations peoples since 2011, and that's been managed over time. The notifications for this have seen an increase in our region. and it's much higher than other hospital and health service regions. So you can see that trend line trending up from 2020. We've seen that increase occur. Again, the different colours, the darker navy is the Torres and Cape, the lighter blue is Cairns and Hinterland. We have the maroon, which is the Townsville Hospital and Health Service, and also Mackay HHS as well. In terms of rheumatic heart disease, we've seen a slight decrease in rheumatic heart disease over time, with a peak around that 2021 period. However, it's still quite high, still obviously very high and affecting that Torres and Cape. Well, it's really affecting across our region broadly. However, it's more obvious in the Torres and Cape region. In terms of rheumatic heart fever, we can see that there has been a decline from 2021 down to 2022, but it seems to be rising again since 2023. Notifiable conditions around influenza. So you can see where COVID struck us all, and we bunkered ourselves into our homes, and we didn't actually circulate any influenza across the community. So it's really obvious by looking at the data, but we can see our most recent data that that's on the incline. And I think we can see that playing out everywhere across the region. In terms of mentally unhealthy days, in the past 30 days for 18 plus and plus, this is the proportion. So across our region, let me have a look, familiarise ourselves. So the lighter Queensland's in the middle here and in this chart, and we've got Torres and Cape, Northern Queensland Primary Health Network average is in the green, and then we've got Cairns and Hinterland in the lighter blue, Townsville and Mackay as well. So quite a number in the Townsville region, 6.2 days out of 30 have been reported as mentally unhealthy across our region. Some key insights around our priority populations and what we've learned. So we know from an earlier slide that 10.8% of our region's population identify as Aboriginal and or Torres Strait Islander peoples. Of this, 6.6% identify as Aboriginal, 2.1% identify as Torres Strait Islander, and 1.9% identify as both Aboriginal and Torres Strait Islander. 33% of this population are aged 0 to 14 years, and 5.8% of the population have a profound or severe disability. We have 27.8% of the Aboriginal and Torres Strait Islander people over the age of 65 and older being found to have a severe disability as well. The unemployment rate is 8.2%. We have 16.5% of Aboriginal and Torres Strait Islander persons living with one or more long-term health condition. And 51% of that population aged 45 years and over have had one or more long-term condition. The most common long-term condition affecting our First Nations population is asthma, followed by diabetes, and then mental health, including depression and anxiety. In terms of refugees, our region has welcomed refugees across our LGAs, and those particular LGAs are listed there: Cairns, Townsville and Flinders. Cairns and Townsville offer refugee health services, and from July 2022 to April 2024, we've had 242 refugees resettled in Townsville and 122 in Cairns, and 50.4% of the Townsville refugees and 53% of Cairns were 18 to 55 years age group. The country of citizenship for Townsville refugees was Central Africa, and for Cairns was Congo. There's limited data around these priority populations, so we really rely on the engagement with our community and with our key stakeholders to understand the health needs of this population. In terms of mums and bubs and smoking during pregnancy, these are the latest figures that we've been able to find. So colours, sorry, I'm mixing up the colours a little bit here. Northern Queensland shown here in the navy. We have Torres and Cape this time in the lighter blue. Cairns and Hinterland Health Service here in the maroon, and then Townsville Hospital Health Service in the yellow, and the green is the Mackay. So you can see there's a large proportion of women still smoking during pregnancy, and that is having a knock-on effect with lots of other child and maternal health issues. So mums and bubs antenatal visits of 8 or more in our region. We measured this data as well. So we have across the region in the Navy 84%. However, in some of our other areas, we've got way less. So you can see Torres and Cape, for instance, are under the, they're a lower percentage at 77%. Not so bad in Townsville and in Mackay, and also in the Cairns region. So mums and bubs preterm births by region. Again, we've provided that information there. So Torres and Cape have the highest preterm births across the region, followed not so closely by the Cairns and Hinterland, and then Townsville Hospital and Health Service region, as well as Mackay. So what have we heard so far? And please feel free to put any questions into the chat. If you've got any of those questions, just click on that little button down in the right-hand corner and you can add questions that we can talk to down the track. So this is a very, I guess, a summary of where we've got feedback over the last 6 to 8 weeks. So we've had the survey running for a couple of months now, and this is just a geographical depiction of where those survey responses have come from. We are still in the process of inputting some of the hard copy surveys that have been mailed back to us as well from our visits in the western areas of our patch. These are the response rates from the LGA. We had, at the end of last week, we had 21 of 31 LGAs represented in the survey results. This week, we've had more survey results come through. We're now over 1,300, and we can say that we've got 29 of the 31 LGAs captured across our region, which is fantastic. What we really wanted to see was an even response or a response from every LGA where possible. So we've really tried to target LGAs based on response rates. So fantastic response from our Western partners. So it's really good to see those smaller communities represented in the surveys. So well done. So as I mentioned, we had over 1,200 surveys last week, but we've now got over 1,300, getting up to 1,350, and we expect to have more to put in over the next couple of weeks as we receive those paper surveys. So there's a proportion of the response rate here across the hospital and health service regions, and we've captured 10% of responses where they have identified that they're either Aboriginal and or Torres Strait Islander. And the majority of the responses have come from that 25 to 74 years age group. Interesting to note, we've had a lot of consumers respond, which is fantastic to see. And we've had a good proportion of health service providers also. Some of the emerging themes that have come out of the survey results, and I'll just go through these by hospital and health service region first, and then we'll look at the overarching themes across the whole region. So in the Torres and Cape, the main themes that came out of the survey to date are around access, chronic disease management, mental health services, Indigenous health, maternal and child health, public and preventative care, alcohol and substance abuse, and coordination and communication. Moving on to the Cairns and Hinterland. The focus there, from what we can see in the survey to date, is around concerns around access, mental health services, chronic disease management, aged care and dementia, public health and preventative care, social determinants of health, special populations, and coordination and communication. Coming down to Townsville, concerns were around access to primary and specialist healthcare, improving infrastructure and workforce, enhanced preventative and community health services, addressing specialised health needs, improving patient experience and system navigation, mental health services, and additional community health services. Finally, in Mackay, the focus again on access, quality of care, affordability, specialised health needs, health coordination and integration, infrastructure and resources, and public health and preventative care, and finally, community support services. So from our healthcare providers, overarching in the survey data, what's concerning is the lack of specialists, mental health and alcohol and other drugs, older persons or aged care, children with developmental delays, and medication shortages. Consumers have identified the barriers as being the cost of visiting a health service provider, the cost of medication, travel, the distance to get to visit a health service provider, and also a lack of specialists, and again, medication shortages. As I mentioned, we have been out and about and engaging across the community. So these are a few happy snaps from the team that have been out and about. So we've held over 70 consultation and engagement activities over the last 2 months. We've been lucky enough to get extensive media coverage around the project. So you hopefully would have seen something around the Joint Regional Needs Assessment in your local paper, online on the socials, or just perhaps in your community. And as I mentioned, we're about to move into the next phase of the project, which is around prioritisation, and that will be commencing in the next couple of weeks. So now it's time to wake up your mobile phones, and we'd love you to throw some responses through Menti, so that we can understand from your perspective what are the current emerging or unmet health needs across your region. And when you're responding, could you please let us know what region you're referring to? So if you're in the Burdekin, just say, I live in the Burdekin and this is an issue, or I live near Cairns and this is an issue, because that helps us understand which region has what issue. And we'd love to capture this as part of our qualitative feedback data. So remember, the Menti code is at the top of the screen. If you have not been able to get in there, thank you. So we've got in Mackay, a lack of access to specialists, health equity for First Nations people. Great to have someone online from the Isaac. Lack of health professionals aligned with population and demand. Mental health, youth mental health. Fantastic, guys. Keep it coming. You can have more than one answer. In Townsville, access to oral health treatment, step up, step down to AOD, mental health care services, early intervention, prevention in childhood Cairns, equitable access to appropriate care. Amazing. Keep them going. I'll keep the slide open for a few more seconds, so you've got time to think about it. What I'll do is I'll just give you another 30 seconds to add your response. So we've got some concerns around social determinants of health, issues with accessing culturally appropriate health care and health equity for the Torres and Cape, multidisciplinary community care for Townsville, mental health support and promotion in schools, 14 to 11-year-olds in Cairns, thank you. health promotion and wellbeing services in the Torres and Cape. One around workforce and staff to deliver services. Social determinants for health, housing, education and early intervention. Additional aged care services on Magnetic Island. And remember, if you have a question, please feel free to throw that into the chat. Mariba, lack of specialists, travel to Cairns, doctors. Equitable access in Isaac to appropriate care, school-based youth health nurses in high schools, Cairns. Amazing. Anyone else got any final current, emerging or unmet health needs across your particular region to add? Psychology in Isaac. Excellent. Travel with travel subsidies, months behind and table ends. Good to know. Any last responses in there before I progress to the next slide? Thank you all so much for your feedback. So in the next slide, we want you to think into the future, thinking about that population. We know we're going to have a large population moving forward. In your opinion, what are the current emerging and unmet health needs across your region?
So we'd probably suggest people to click on the
Q&A?
the options that are available for them, and they can select those. So if they hit the plus sign there, yeah.
All right, we've got some votes coming in. Here we go. So you can have more than one vote. I think there's 3 in total. So you can upvote something that's already there if you'd like to add onto that. Let's try and get some responses in on this one. This one will allow you to do some free text. In your opinion, what are the barriers in accessing primary care services across your region? Limited supply, cost of services, lack of workforce, travel, limited public transport, workforce. Don't forget to add in where you're what region you're representing if you can. That would be great. Excellent. Mariba, lack of doctors, allied health, poor quality travel, health literacy, limited supply in RACFs. Isaac, yep, drive in, drive out, and fly in, fly out workforce, wait times, service capacity. Isaac, lack of continuity of care. Lots of feedback coming from Isaac. Cost of travel, limited access in Mariba, continuity of care. You know, no one talking to each other. Extensive wait times, limited workforce, and in the northwest, the transport and competence in healthcare staff providing culturally appropriate and safe care. Limited access to GPs and the cost in Mackay, and suitable accommodation, and limited compounding poor health outcomes, lack of trust, transient population in the Whitsundays. slowness of moving through the system. Psych services and aged care, the cost of health and Mariba, access to specialists, travelling costs to Cairns or to Brisbane in some cases. LIFO workforce blamed, but resident population shows low delivery outcomes in ISAC. High gap payment on top of Medicare subsidies, loneliness and isolation. Right, so we've had 35 responses so far. Any other barriers that you would like us to know about for your particular region? No real government commitment to staff shortages in health. Okay, so let's start some voting. So we had all of those, all your comments on that screen. So now it's time to throw some voting over the top. If you'd like to upvote any of those key barriers. Okay, let's have a look and see what people have voted on. So we had 25 votes all up, and workforce was high, followed by the cost of attending a GP, bulk billing, cost of services. So I guess we could merge those together. Travel, lack of trust was also got a couple of votes, and the supply and the wait times, also a little bit of a double up there. But some votes further down, again on workforce and shortages, and then equal votes on the remainder of those. Thank you, that was great to get everybody's feedback. I can't see any questions that have come through into the chat. So I'd just like to take the opportunity to thank you all for joining us this evening. I'm going to stop sharing my screen now and would like to bid you all a nice evening, and we will be circulating the recording of this once we've had time to review and make sure that it's ready to go out. But really appreciate everybody's time this evening, and I hope that it's been a valuable exercise. Thank you, everyone.